All right. I say we just go for it. It's being recorded. So if someone misses some opening comments, they can go back and listen in. I know people will be joining over their lunch hour. So welcome, everyone. My name is Natalie Sampson. I am the co-lead of our M-LEEaD Center's Community Engagement Core. And the Community Engagement Core is part of the Michigan Center on Life Stage Environmental Exposures and Disease, if you got all that. And we are supported by a National Institute for Environmental Health Sciences grant. And I'll just say the work that we're doing is really guided by an advocacy board. One of our members is our speaker today, Angie Reyes, but we've also got folks from Eastside Community Network, Detroiters Working for Environmental Justice, the Detroit Health Department, and many other orgs throughout Metro Detroit. And so we're really grateful for those folks coming together with us. And as a team, we really try to connect community with youth, with policymakers, with researchers. And we do that through events like this, informative materials, legislative forums, partnership grants, and many other initiatives. So this particular webinar is part of a series called Residents and Researchers. And we really try to focus our time together about once a month on action-oriented, solutions-oriented research, and just understanding issues that impact environmental health and justice. And so we'll share the link, but you can go back and watch a bunch of these. We've had topics including air quality standards, disaster preparedness, healthcare waste, immigrant worker health, and so on. And so we encourage you to check them out. So I don't want to waste any time. I want to get to our speakers. I will encourage you, we're going to spend the first 2/3 of our time together listening to our speakers chat, but please use the Q&A and I'll be tracking on that. So when we get to the end, we can make sure there's some time for those questions, and I'll try to make sure we address any of those coming up for you all. So today we're going to talk about gentrification and displacement in Detroit. And we know that this is not a new topic. This is something that lots of folks are working on and thinking about and dealing with. As the city continues to see changes, residents are really, asking lots of questions and navigating this. And so, again, we're thinking about it from an equity lens, from a health lens, from an environmental justice lens. So I think we have two of the right people here to talk about it. So I'm going to introduce and hand off. So we have Angie Reyes. I will say the legend. Angie is a lifelong Detroiter. She's also the founder and executive director of Detroit Hispanic Development Corporation, which she started in 1997. And you might know Angie if you're local. She works on a variety of issues, but also nationally and internationally in those conversations related to youth gangs and violence, substance abuse, immigration, educational reform, policy development, community organizing, community-based participatory research, you name it. We also have Adrianna Spindle-Jackson. Adrianna she has Michigan roots, but she is currently a doctoral student at Boston University, and her research centers on housing justice, and she examines housing pathways, patterns, policy implementation, and housing assistance utilization, so very relevant to our discussion on gentrification. And she also has worked for several years as a family therapist at a youth emergency shelter. So I am going to hand it off to Adrianna to kick us off, and we'll see where the conversation goes. So the floor is yours.
Thank you so much. So I'm just going to make sure I can share. All right. So thank you so much again, Natalie, for that introduction. And hi to everyone. I'm excited to be here with you all and with Angie. I'm going to share some of my dissertation work with you today, which focused on Black residents' experiences with gentrification and neighborhood change in Detroit. Like I'm on a line. There we go. So just a quick overview of what I'll be touching on today. So I like to start with some brief insight into who I am and how I enter into this work. And I'll also touch on how I think about gentrification and public health and how I have thought about this connection when it comes to my dissertation work. Then the bulk of what I'll share are some qualitative data from my dissertation, including an overview of the study and some findings. And finally, I'll end with some lessons learned, which for me always includes some questions that linger and that can hopefully add to the conversation we'll have to close out today's webinar. So like I said, it always feels important to me to situate myself within as a person and a human within this work, particularly as someone who is not from Michigan or currently living in Michigan, but is studying Detroit and Michigan. And so I'm a Black biracial queer woman. I was born and raised in Oakland, California, but both of my parents were born and raised in Michigan. And my dad's family, like many other Black families, were part of the Great Migration, and my grandmother moved from Reynolds, Georgia to Detroit, Michigan, where she had 5 children, including my dad. And so I grew up with my grandparents, aunts, uncles, cousins, sort of everybody living in Detroit. But over the last 10 years, everyone has moved outside of Detroit. So at this point, none of my family that I visited growing up lives there anymore. And so I had this anecdotal personal experience that planted the seeds for what would become my dissertation study and areas that I've come to focus on as a researcher. And so I'm also, as Natalie mentioned, a PhD candidate. I try to be very mindful of what it means to be a researcher and entering into community engaged spaces. And so I try to be really cognizant of how all of these aspects of who I am play into my role as a researcher. And I spent a lot of time reflecting on all of these things throughout my dissertation work and continue to do so. So I wanted to, again, include a brief overview of how I think about gentrification and public health and how this has informed my study. And as we probably all know, a core part of that are social determinants of health. So non-medical factors that impact health outcomes, where people are born, live, learn, work, play, age. And in the case of gentrification, there are multiple streams related to its processes that we can identify within these categories. So physical resources becoming harder to access, for example, or in some cases becoming completely inaccessible, like affordable food, reliable stores, housing in some cases, and for some people certainly, being shut down or relocating due to rising prices. Or rent prices, and then also social norms and practices. So how these processes can become disrupted or less accessible due to gentrification. So things like people's social networks. How are people relying on things like childcare, emotional support, community, perceived safety, and so on. And this is also seen in the loss of community and third spaces that feel safe and welcoming to longtime residents. So these sort of broad areas can be seen as upstream determinants of health. And therefore, it's reasonable to highlight that gentrification impacts health. And that we should be talking about both the physical and mental ramifications of gentrification. And this is really one of the underlying threads that guides and guided my work and the dissertation study that I'll turn to in just a moment, is looking at how residents are experiencing these things, right? So we can have surveys, we can identify sort of the market trends within a space, and it's equally as important, I believe, to center the experience of residents within these processes. So a brief overview of my dissertation. My research questions were, how do Black residents in Detroit, Michigan experience neighborhood change? And how do Black residents in Detroit, Michigan make sense of neighborhood change? And the use of neighborhood change was intentional here after conversations with my committee and reflection. That said, the term gentrification itself, both explicitly and implicitly, came up in every interview that I did. And so that was sort of like a thread across the themes that I'll talk about within itself. I focused on 5 zip code areas that essentially make up a ring around the downtown core of Detroit that has seen a lot of investment. Residents self-identified as Black or African American. And the criteria is that they have lived within one of the zip codes for at least 5 years. I will say that nearly all, I believe 14 out of the 15, lived in Detroit in one of these areas for at least 10 years, some upwards of 20 years, with a lot of generational ties. So I completed 15 in-depth qualitative interviews with a semi-structured protocol and used reflective thematic analysis to analyze the data. So these are the 4 themes that resulted from the analytic process. And I'm just going to share some brief quotes and examples from each before wrapping up with some, again, questions and lessons learned. And we'll go through each one. So the first theme was respect older generations, challenging new norms. Among the older adults that were interviewed, which made up more than half of the residents that I talked to, nearly all spoke to perceived generational differences between longtime residents and younger generations moving into neighborhoods. And there was also an emphasis on how this alone can cause tension, but also specific examples of some of what those differences looked like. And so one resident described this as, I've noticed that a lot of folks are coming in the city and they're starting their own organizations without checking to see, does anything like this already exist? Is this something that I can join? And it's like, no, they don't want to join it. They want to start their own thing and be the leader. And that causes conflicts. And so this idea of sort of not reinventing the wheel, right? And doing due diligence to connect with neighbors, to connect with stakeholders, to connect with longtime advocates in neighborhoods to see where partnership can happen rather than creating something that already exists. The second theme, attachment to place or to changing place. So a lot of residents reflected on places that no longer exist, that have meaning to them. And so how that feels to still exist within a place or within a neighborhood that are losing these places that hold a lot of meaning. And this resident said, that area, I used to hang out. I liked to go there. And it had a lot of memories because my first husband, my sister, and a lot of my cousins, a lot of us hung out there a lot. So that was some place I did like going to sit here and there, but now it's gone. And so there was some acknowledgement, there's definitely acknowledgement of how physical space has changed, but it was really quite often paired with further reflection on the symbolism of that change and sort of a reflection of how that feels and what it means to no longer be able to frequent these spaces that have a lot of meaning. The third theme, concerns about historical and generational preservation alongside change. So this resident shared, because I'm part of the city, I live here, I'm part. I don't want all this history and things to be thrown away. And people walking down the street as if they own it. I'm like, no, you can get over here too. We are going to share this. And that's what's important to me. This is my city. I was born and raised here. We have a lot of history here. So residents talked about their experience with history in the city. This often looked like talking about Black culture in Detroit and what it's felt like and has meant to experience that and how that they recognize that changing. And some of this also is related to the previous theme that I just touched on in terms of a lack of connection and feeling like people were not willing to enter into an acknowledgement and sort of a willingness and curiosity to learn about a neighborhood, like the history of the neighborhood and also Detroit at large, and how that feels as a longtime resident. And then finally, weighing benefits and challenges of changing neighborhoods. And so essentially residents weighed some pros and cons of what they their perceived pros and cons of change in the neighborhood and of gentrification. And there was acknowledgement among this group of residents, at least, about certain benefits that come with gentrification, like increased amenities, access to certain stores, and in some cases, green spaces. But there was also an immediate acknowledgement, usually right after, of, but why hasn't this been here all along? We've been advocating for these things for years, for decades. Why now? And so this resident shared, well, for the better is because it needed a lift. It really did. And it makes the area look better and everything. The most change that really got me, the most is the bike trail, because I see how we grew up. Nobody thought about giving us a bike trail. And this was a common sentiment shared from residents, was sort of reflecting on these perceived benefits, what they identified as benefits, but then negotiating, why wasn't this already here? So some brief, again, lessons learned and takeaways. A range of perceived changes were identified, and some were in tension with one another and were based on age cohort, historical connection to Detroit and the neighborhoods, and also varying neighborhood involvement differences. And so something to keep in mind too is this is obviously, there were 15 people interviewed, but it's a good reminder that even when focusing on a particular minoritized group, groups are not monolithic, and it's important to capture as many experiences as possible, and to recognize that there will be variance within different group experiences. And then just from like an engagement perspective, trust and buy-in. So it's part of why I like to situate myself within the work before I even talk about it in academic spaces as well. While there may be a need to increase the amount of voices within academia and scholarship, for example, as Natalie mentioned, there is no shortage, and there has not been any shortage of voices uplifting these issues and challenges and thoughts within neighborhoods and the city of Detroit. And so what does it mean to be really intentional about knowing that, reflecting that within the work, and engaging in partnerships in order to reflect that? And then there's, as I mentioned before, a rightful discussion around physical displacement as a result of gentrification. And there are also these other symbolic aspects of displacement and senses of belonging within Detroit for people that are not necessarily physically displaced, that also warrant discussion and understanding right alongside what it means to have people physically displaced, because we know that that is happening as well. And so as researchers and collaborators, how can we be responsive to this fact? And how is gentrification being studied? Is there room to challenge some of that and complicate some of what we're used to seeing within discourse around gentrification? Thank you so much.
Thank you. We will shift over to Angie, but feel free to start throwing questions in now. We'll get to those in a little bit. So Angie, I think you are a resident and a researcher and an advocate. So this webinar series is appropriate. I will hand it to you.
Thank you, Natalie. Just working on getting this there we go. So thank you again. My name is Angie Reyes, and I am a lifelong resident of Detroit, of Southwest Detroit, and have also been a founding member of the Detroit Urban Research Center that has been conducting community-based participatory research in the city of Detroit for almost 30 years. So although I'm not an academic, I have been involved in a number of research projects. But this is based mostly on my own lived experience rather than a lot of research, although there's some research that has been involved. And before I start talking about gentrification in Southwest Detroit and displacement, I just want to give a little bit of historical context. So in Southwest Detroit, for those of you who may not know, is the largest Latino community in the state of Michigan. And we're not new to Detroit. Our community actually started in the late 1800s, early 1900s. So although I'm kind of old, the community is much older than me. People came up from south of the border during the Great Migration. They just came from further south, and people came looking for jobs and also wanted to leave the area of the Southwest U.S. because of the extreme racism and discrimination that existed against Latinos in the Southwest U.S. So Michigan seemed like a place where people could come and get jobs and escape some of that extreme level of racism. So the Latino community actually started in what is known as Corktown. It was originally colonized by the Irish, and subsequent to that, Latino community, and not just Mexicans, Puerto Ricans, particularly in the turn of the century, moved into this area of the city, which is in zip code 48216. So there has been a series of displacements that have happened in the Latino community that have kind of mirrored a lot of what had been happening at the same time in the African American community. So the Ambassador Bridge, which was first built in 1929, has continued to expand. It is the busiest northern border crossing in the country. And you can see the picture up on the left-hand corner of what the original footprint of the Ambassador Bridge was. I'll show you some pictures of what it is now, but you can see that originally it was surrounded by homes. There are a lot of beautiful brick homes that does not exist anymore. We also had the freeways that came through I-75 that split our neighborhood. And actually the first section of I-75 that was built in Detroit was in Southwest Detroit, from Schaefer to West Grand Boulevard, and it split the community in half as it came through. Our main thoroughfare at the time in our community was not West Verner, it was Bagley. Bagley went from downtown all the way to West Grand Boulevard, and that was the primary commercial strip in our community, where there were stores and theaters and a number of homes. Actually, the home where I was born and my grandparents lived, and I lived the earliest years of my life, was on Bagley. And then the city decided that Corktown was a slum area, is what they referred to it in the 60s, late 50s, early 60s, and decided that they wanted to do light industry here. So any of you that are familiar with Corktown and have been here know that there are a few blocks where there's some really beautiful Victorian homes that are now going for about $1 million. Originally, this whole area were all old Victorian homes, beautiful homes. The city tore down 3/4 of them in the starting around 1956 and going into the 1960s. And actually, our building where our current office is in Corktown on Trumbull. And I was recently told by my aunts that my grandfather's little store that he used to own used to exist underneath where our building currently is now. So it's come full circle. So it was kind of an interesting thing to find out. So this is 1963. The city decided to do this urban renewal, or as we refer to it as urban removal. And you can see as they were also demolishing really critical areas in the African American community, they were also doing that in Corktown. So you can see where Corktown was also targeted for redevelopment, and that's when they decided to tear down much of the housing and businesses in our area. You can see here some of the early pictures up here of the Ambassador Bridge and all the homes that exist. And on the right is what it looks like now. It's a lot of cement, and it's still continuing to expand. On the bottom picture is where that's a current picture of where the plaza for the Ambassador Bridge is currently expanded. And just to the right of that is St. Anne's Church, which is the oldest church in the city of Detroit and the second oldest Catholic church in the country. And they've just been taking over more and more of that area. So we've lost considerable housing stock because of the expansion of the Ambassador Bridge. Now we have a second bridge that is being built in our community, the Gordie Howe Bridge, which is predominantly impacted the part of Southwest Detroit, which is known as the Delray community, which is south of 4th Street. There's been a series of community organizing that has gone on where people were trying to protest a second bridge being built in our community. It's about maybe 2 miles, not even 2 miles from the current Ambassador Bridge. But as you can tell that battle was lost. So we lost a lot of housing stock in that area as well too. And this is a map that shows kind of the current footprint of the Gordie Howe Bridge and their plaza, which extends, the impact extends to north of I-75 because of the I-75 expansion around the Ambassador Bridge to create all of the ramps. So it extends into into the most densely populated part of the city of Detroit, where we also are losing housing along the freeway expansion there as well. So one of the impacts is that, again, we are on the busiest northern border crossing in the country, is that Border Patrol and ICE has a huge presence in our community, which will be expanding with the two bridges. So one of the impacts is when you have people who move into our community who are not from here and not familiar to some of the cultural norms of Latino families. We tend to have large families. Sometimes we're loud. We have big family parties. And people will not only call the police, they will call Border Patrol, which will result in families being deported and completely losing access to their home and sometimes their children. So people get disappeared all the time from our community because of Border Patrol presence in our community, which is really dangerous. It has also pushed people further downriver where there are not protections there too. So people are vulnerable to a higher level of racism and racial profiling in that area. And because we are so close to the border, it's sometimes referred to as a constitution-free zone, where the police and Border Patrol do not have to have reasonable cause to stop you. Racial profiling is allowed. So people can be stopped just because of the way you look, even if you were born here. And we do have a history in this country, including here in our community, of deportations. The last mass deportation in the 1930s, actually 60% of the people who were deported were US citizens who had never been to Mexico in their lives, but were deported. So we know it happened before, it can happen again. These are some of the current housing costs in our neighborhood. 10 years ago, you could buy a beautiful home for $80,000. The average price of a house now is $250,000. We're all taken off of Zillow just in the past few days. So you can see the tremendous increase in housing as the community has been shifting and changing, especially, things that have been driving some of that, not only the bridge, but the renovation of Michigan Central, a lot of the construction that's happening and development in our community in Corktown is pushing further and further west into the core of Southwest Detroit, until 48209 and even 48210 zip codes, causing housing costs to really rapidly rise, which is becoming unaffordable for even middle-class residents in our community. Rent has also gone up from like $500 to $700 a month to about $2,500 a month. So people are being priced out very rapidly in our community. So it's now cheaper for people to move downriver in places like Lincoln Park and Ecorse rather than to live in Detroit, which is continuing the displacement and the push of our community further and further west. And Adrianna kind of alluded to this as well too, is that it's more than just physical displacement. This is from a report that Data Driven Detroit called Turning the Corner Around Gentrification. And this resident had said, it feels strange, like I'm not displaced, but I am somehow because of the cultural shift in our community. And you can see this was in 2018. So already the shift had started to happen. That was at 4 years ago, 5-6 years ago. So it's continuing to exacerbate and to get worse. So some of the policy issues that we've been talking about in our community to address some of these things are trying to develop a range of housing options that are truly affordable and equitable. So our organization, Detroit Hispanic Development Corporation, has been partnering with 4 other Southwest Detroit community-based organizations, South Detroit Business Association, Urban Neighborhoods Initiatives, Congress of Community and Bridging Neighborhoods, to look at how we can pool our collective resources and expertise to create a whole range of housing options, from rental that are affordable to what they call working families to market rate. So that people have different options. They can rent, they can buy. What does that look like? Building apartment buildings for single individuals is not really sustainable for our community. We have large families. We need bigger homes in order to support our families. Also advocating for changing state laws. Michigan has, at the state level, laws that prohibit rental control, which is something that has really made the increase worse, because we're not able to address those issues at a local level because it covers the whole state. Creating financing alternatives for the unbanked, because a lot of our community can't open a bank account or are not familiar with bank accounts, even people who are citizens. So trying to find what those alternatives are. There are some CDFIs that will lend to undocumented people, but not in this area and not for housing. So trying to find those financing alternatives so people can afford to get a mortgage on their house. Also creating protections against predatory lending. A lot of people have been buying houses because they're unbanked through land contracts, but we have a lot of predators who will sell a house that they don't own. So people will be paying on a land contract, but they're not really actually paying the owner. So they'll end up with no money and no house at the end. Increasing the grants and small loans for home repair is a critical issue. There have been some programs that the city has been developing, but it's still not enough to address the extent of home repairs that need to be made. The homes in our community are upwards of 100 years old. So if you can imagine, the infrastructure of a lot of the houses is very old. And because we have so issues like truck traffic in our community and air quality issues, not having proper windows or air conditioning and things that can filter a lot of the diesel fuel and the air pollutants out of the home creates other health disparities in our community. And then creating systems so that new people are moving into our community understand and respect the history and culture of the community, which is really critical. It's not that we don't want other people moving into our community, but having that understanding, first of all, willing to have an understanding, and then being respectful of the people and the history that has existed before and not trying to replace it. We frequently have had people who have bought property in our community and they try to rename the whole neighborhood. They come up with other names, and we've been experiencing that for 500 years of other people coming into our land and thinking that they're the first ones here and they want to reclaim it for themselves and call it something different. We really want to make sure that we break those cycles and don't allow those kind of things to happen. Thank you.
Thanks to you both. And there were definitely some parallels, I think. And thanks for sharing both your personal stories in there too. Lots of questions coming our way. Adrianna, you might be able to speak to this. I know Angie can, given some of the work you've done, and you alluded to environmental issues, but there is one question asking about how race-based residential segregation, how that relates to disproportionate exposure for communities of color to environmental pollutants and that experience with gentrification. There's many layers. I don't know if you want to speak to that a little bit, either of you.
Sure. And through the studies we've done with together with Amy Schultz, who is one of our academic partners in a lot of this work, we know that a lot of pollutants disproportionate exposure is really concentrated in communities of color, which is not by mistake or happenstance. It's usually on purpose, so that communities that have more power and that are not predominantly people of color tend to have more political power and are able to prevent those kind of things, and zoning laws and a number of ways they're able to prevent those kind of things from being built in their community, and paying closer attention to them. The ironic thing is that now that more people are moving into our community from other socioeconomic groups. As we've been part of what our organization does is a lot of voter registration, GOTV work. And so we're doing canvassing door to door. And we said there are new folks in our community who are now saying, can we get the trucks out of the neighborhood? How come there's so many trucks in this neighborhood? And I didn't realize the air quality was so bad. So yeah, and there is more of an effort to pay attention to those things. So we're hoping that it's because the government is interested in protecting vulnerable populations and not just because there are other people moving into our community who are not Black and brown.
Yeah. Adrianna, and it sounds like, I don't know if your interviews brought up sort of the environmental justice issues from the exposure side, but it sounds like it did talk about, the interviewees talked a little bit about the amenities and what it takes for a community to thrive and how those are not experienced equally. I don't know if you had other reflections on that or wanted to share anything else.
Yeah, I mean, largely what Angie just highlighted, but there were a fair amount of folks that I talked to who were very actively engaged civically at the municipal level. And so thinking about how, like Angie just pointed out, a lot of these concentrations that we see are by design and can be traced back to policy, both historically and into present day. And so what does it look like to really have, again, the folks that have been talking about these things have been advocating and acknowledging that these are patterns that have been repeated and that are happening, advocating on a political level related to this. And so that's certainly something that residents talked about alongside, that was very much connected to talking about why amenities have not been more prominent in neighborhoods and why they are now, right? Like a lot of it is related to urban renewal, quote unquote, and policies that have been connected to that.
Well, thank you for commenting on that. And then I guess part of this, Angie, one of the questions here talks about any policy initiatives. And I said, Angie, because I know you spelled out some real goals at the end of your talk, but I think if either of you, have you seen examples of things happening that are addressing this cycle of gentrification and displacement in practice? Or it's like your wish list is, the organizing and the coalition building. And Adrianna, if any of your interviewees talked about some of the solutions, I'd be curious to hear that.
There are grassroots efforts to change some of the policies, but we have not yet seen policy changes. More the opposite. We see things more that are kind of lending itself to more gentrification. Some of that I understand because, the city needs to increase its tax base and there are a lot of things tied to that, right? And the city lost a lot of population, but how do we do that in ways that don't displace the other people who've been here for a long time and have been working so hard to improve our communities? And then sometimes we feel like we did such a good job, now we can't afford to live here anymore.
I'll just quickly add on that folks definitely talked about grassroots organizing, both that they've heard about or directly been a part of, and that this also came up in how some people kind of really negotiated, like, hey, there are aspects of processes related to change and to gentrification that I might benefit from, the neighborhood might benefit from, and also, is there a different way to do this? Like, we have to be a part, more central and more integral in decision-making processes so that the needs and the well-being and the impact of longtime residents is not lost or an afterthought. And so at least within, again, the group that I spoke to, there was a real negotiation there of what does that look like? It's been challenging. And so how can these conversations, again, become more central within decision-making processes so that policy decisions and neighborhood-based decisions can feel equitable for everyone involved.
Someone's also asking about evictions and are evictions impacting housing and those connections? And obviously, we know there's a long history of navigating vacant spaces and the disinvestment and some of the things you've talked about, the historic policies, but any thoughts on how those all interact together?
Especially post-COVID, there have been a lot of a huge increase in evictions because of the moratorium that was lifted after the pandemic. Fortunately, in Detroit, at least, there was some legislation passed so that people have access to attorneys for free to help prevent evictions. But definitely, that's when we see a lot, especially in our community, that where we have people who are new immigrants and maybe undocumented, they're very much at risk for evictions, so that they can raise the rent. The landlords are looking to increase the rent, and the only way we can do that is to get rid of the people who are there, and they have really no legal recourse in those cases. So it definitely plays into that.
I'll also quickly add that evictions, I was going to say the same thing in terms of post-COVID and how post-COVID evictions and after a lot of those moratoriums, the rates just really shot up with minimal support for folks. But within interviews, at least too, a number of folks talked about how they were actually like secure within their housing, but would are constantly getting realtors who are quite pushy about selling, or is your neighbor interested in selling, and navigating that, which again is not, it's very different than an eviction pathway. However, is something worth noting in terms of how people are assuming people are existing within their housing in these neighborhoods, and what they want. And so it's also just an interesting aspect of this conversation as well.
Yeah, I'm seeing Angie's Zillow postings were really stark and eye-opening for sure. And to that same vein, someone was asking about wealth building for families. So you talked about some families moving to other communities and what this means for passing down, especially if you have big families and intergenerational bonds. Any thoughts about how displacement and wealth are impacting communities?
Those are definitely issues. I mean, I think there's a lot of the conditions that are very much the same in the Latino and African American communities, where, you just pass a house down and people are living there without the deed after grandparents or whoever has passed. So there's some efforts now to try to help people clean up all the legal documents so that they can have legal ownership of their home. But people are very vulnerable in that case. It really, for me, maybe because I'm older, but it reminds me of some of the historical context where for Indigenous people and for Mexicans as well too, when the U.S. took over, stole northern occupied Mexico, California, a lot of the land, they were told in treaties that land still would belong to the people who used to be there, but because it was communally owned, the other people came in and took it away from them. So it's kind of that same thing that's happening now, because it's really communally owned homes by families, and so there's no clear title, so other people can come in and take it away from people. So that really is a challenge for many people.
I'll just add two thoughts to that. One is that there were a good number of folks that I talked to who had lived outside of Detroit for a while, but due to aging family members moved back to Detroit in order to maintain housing that had been in the family for generations, and having that be a really important factor in moving back, and then navigating, oh my goodness, this is a neighborhood I grew up in and it's really different, and I'm maintaining this household. And so thinking of it that way. And the other thing I think about, particularly with the first part of the question, are people being fairly compensated for their ultimate displacement, is knowing the numbers, like knowing who's been displaced and where they end up, and how that can be a challenging number to capture. And so also thinking about what does it mean to really understand what physical displacement is looking like, and the impacts that are resulting in terms of health.
Right, I'm going to try to squeeze in two more questions here. One is directly from a landscape architect. So we're talking about greening spaces. We're thinking about how vacant lots are handled, how neighborhoods are managing this. So any advice for someone who wants to do this the right way? I have some ideas, but I'm not the expert. You two, what are your thoughts?
I think you're also an expert, Natalie. But of course, I think, and it's a lot of the things too that Adrianna had said, is the centering community voice and involving residents in that whole, not just the discussion, but decision-making about what is their community, what should it look like, what do we want to have, what do we need to have in our community in order for it to be a thriving place for children and elders and everybody in between to be able to live in that community.
I'll just add on, because I was going to say pretty much word for word the same thing, but to also think about what continuing relationships look like. So like not just having a one-off conversation at the beginning of decision-making, but really continuing to build relationships and partnerships with folks, and also having the conversations not only center on like literally what do you want this space to look like, but also what does this space, what can it mean for this neighborhood? Like, again, thinking about symbolic places, third spaces for folks in neighborhoods, like what is needed and how can that be a part of the decision-making process?
Absolutely. So we're getting to these last few questions as we wrap up. A lot of how do we do this? What does it look like? How do we get involved? So any advice in general to folks who really want to? I mean, I really appreciate that you all grounded us in history and recognized, the complex nature of community, sustaining communities, community building, those relationships, all of that. You can't separate from, I know we're talking from an environmental health center and environmental justice issues, but Adrianna set it up, talking about those social determinants of health at the beginning, but so much more. So how do we navigate these conversations? How do we bring people into these conversations? I think people on this call do really care and want to get it right, but we know that it takes a lot of work. So what advice do you have?
That's a good question. Getting involved in organizations. We have quite a few organizations in Detroit that are focused on some of these issues: environmental justice, community organizing. We have a really robust ecosystem in Detroit of people who are all doing this work. So I think, as Adrianna had mentioned early on, don't come in and try to create something new. There are people who are already doing this work. Find those people and help. See how you can help piggyback on some of the work, because not only are you recreating the wheel, you're also taking limited resources away from the organizations that currently exist and that are run and led by people of color, right? So make sure that you're not contributing to their, actually, we've talked a lot about the gentrification of nonprofits in the city of Detroit lately. That's also happening. So make sure that you're not doing that, but looking at where are the people who are already doing the work in the community that you can help and piggyback on. And I think that's really critical.
Leading with curiosity, right? And I found that a lot of times when I was trying to recruit, I was lucky to have be able to be in Detroit to do a lot of like face-to-face on the ground recruitment, and to just talk with people and just ask questions. And a lot of times, even if folks didn't live in these zip codes, they'd be like, here's my email, I'm really curious to see, or like to keep in touch or to follow up. And so there's a lot of willingness to connect around these things. And so just thinking about what it means to be curious.
Good final words there. Thank you both for taking time today for this. Angie, I have a feeling you already knew about those trucks and we're already working on it. When you were mentioning the newbies and sort of the issues coming up. Yes, I think leading with curiosity and figuring out who's already doing the work, that seems like some great major takeaways, if nothing else comes out of today's session. So thank you both. We have some exciting sessions coming up in November and December, one looking at plastics, one looking at, again, looking at some history and legacy pollution and how we make sense of how history has shaped where we're at today. So segueing nicely from today's conversation, I think. So again, thank you, Angie and Adrianna. We appreciate your expertise and your sharing your own stories, and hope everyone has a good day. Wrap it up.
Thank you.
Thank you.